Brachial Plexus and Radial Nerve. Dr. Saeed Vora and Dr. Dansana Al-Sarawi. Objectives. At the end of this lecture, the student should be able to describe the formation of brachial plexus, site, roots and stages. List the main branches of brachial plexus. Describe the course of radial nerve. List the motor and sensory distribution of radial nerve. Describe the effects in cases of lesion of the brachial plexus and radial nerve. Formation of brachial plexuses. It is formed in the posterior triangle of the neck. It is the union of the anterior brachii of the 5th, 6th, 7th, 8th cervical and the 1st thoracic spinal nerves. Divisions. The plexus is divided into roots, trunks, divisions, cords. Terminal branches. Trunks: upper trunk, middle trunk, lower trunk. Union of the roots of C5 and 6. Middle trunk. Continuation of the root of C7. Lower trunk. Union of the roots of C8 and T1. Divisions and cord. Posterior cord. Each trunk divides into anterior and posterior division. Posterior cord. From the 3 posterior divisions. Lateral cord. From the anterior divisions of the upper and middle cords. Cords and branches. Medial cord branches. It is the continuation of the anterior division of the lower trunk. Branches. All 3 cords will give branches, those will supply their respective regions. The brachial plexus, 2 ultra, form U, upper roots, trunk, lateral cord. Long thoracic. Nerve to subclavius. Dorsal scapular. Lateral cord. 2 upper trunk. Suprascapular. Roots. C5. C6. Middle trunk. Posterior cord. Ultra. C7. Lower trunk. C8. Medial cord. Form U. T1. Anterior divisions. Posterior divisions. Roots, in the posterior trunks, in the posterior. The plexus can be divided into 5 stages. Roots, in the posterior. Trunks, in the posterior. Divisions, behind the clavicle. Cords, in the axilla. Branches, in the axilla. The first 2 stages lie in the posterior triangle, while the last 2 stages lie in the axilla. Branches, A, from roots. 1. C5, nerve to rhomboids, dorsal scapular nerve. 2. C5, 6 and 7, long thoracic nerve. B, from trunk, upper trunk. Nerve to subclavius. Suprascapular nerve, supplies supraspinatus and infraspinatus. The brachial plexus, 2 ultra, form U, upper roots, trunk, lateral cord. Long thoracic. Nerve to subclavius. Dorsal scapular. Lateral cord. 2 upper trunk. Suprascapular. Roots. C5. C6. Middle trunk. Posterior cord. Ultra. C7. Lower trunk. C8. Medial cord. Form U. T1. Anterior divisions. Posterior divisions. C branches from cords. Lateral cord. 2 Lateral pectoral N. Lateral root to median N. Musculocutaneous N. C5. C6. C7. C8. T1. Medial cord. Form U. Medial pectoral N. Medial root to median N. Medial cutaneous end of arm. Medial cutaneous end of forearm. Ulnar end. Posterior cord. Ultra. Upper subscapular end. Lower subscapular end. Thoracodorsal end. Radial end. Axillary end. Relation to axillary artery. 2. First part. The three cords are above and lateral. 2. Second part. The cords are given names according their relations with axillary artery. Medial cord, medial. Lateral cord, lateral. Posterior cord, behind. Relation to axillary artery. 2. Third part. Has the same relationship with the terminal branches of the brachial plexus. Radial nerve, C5, 6, 7, 8, and T1. Origin, it is a continuation of the posterior cord of brachial plexus. Course and relation. In the axilla it lies behind third part of axillary artery. Radial nerve in the arm. In the posterior compartment of the arm, it runs in the spiral groove of humerus, deep to lateral head of triceps. At the lateral end of the spiral groove, it turns forwards and pierces the lateral intermuscular septum to enter the anterior compartment of the arm and groove between brachialis medially and brachioradialis laterally. Radial nerve in the forearm. In the cubital fossa, it lies in front of lateral epicondyle, then under cover of brachioradialis. It terminates by dividing into two terminal branches. Superficial branch. Deep branch, posterior interosseous nerve. Medial epicon. Branches of radial nerve. In the axilla. Muscular, long head and medial heads of triceps. Cutaneous, posterior cutaneous nerve of arm supplies the skin at back of arm. In the spiral groove. Muscular, medial and lateral heads of triceps plus anconeus. Cutaneous. 1. Lower lateral cutaneous nerve of the arm. 2. Posterior cutaneous nerve of forearm. Branches of radial nerve. In anterior compartment of the arm in the groove between brachialis and brachioradialis. Muscular. Lateral fibers of brachialis. Nerve to brachioradialis. Nerve to extensor carpi radialis longus. Terminal branches. Superficial branch. Deep branch, posterior interosseous nerve. Superficial terminal branch of radial nerve. It is a continuation of the radial nerve. It descends in front of lateral side of forearm to reach the dorsum of the hand. It has no branches in the forearm. Superficial terminal branch of radial nerve. Above wrist, it turns posterior to pass superficial to extensor reticulum to supply. Skin of lateral 2/3 of back of hand. Skin over the back of proximal phalanges of lateral 3½ fingers. Deep branch of radial nerve, posterior interosseous nerve. It pierces the supinator muscle and turns around the neck of radius to reach back of forearm, descending between superficial and deep muscles of the back of the forearm. It supplies the muscles of posterior compartment via forearm, cutaneous and digital areas supplied by radial. Posterior view. Cutaneous nerves. Injuries to the radial nerve in the axilla. Motor. The triceps, the anconeus, and the long extensors of the wrist are paralyzed. The patient is unable to extend the elbow joint, the wrist joint, and the fingers, so the characteristic deformity is wrist drop, or flexion of the wrist. Sensory. A small loss of skin sensation in posterior surface of the lower part of the arm and down a narrow strip on the back of the forearm. Sensory loss on the lateral part of the dorsum of the hand and on the dorsal surface of the roots of the lateral 3½ fingers. Brachial plexus injuries. The roots, trunks, and divisions of the brachial plexus reside in the lower part of the neck, whereas the cords and most of the branches of the plexus lie in the axilla. So, complete lesions involving all the roots of the plexus are rare. Dr. Vorak. Brachial plexus injuries. Upper lesions of the brachial plexus upper trunk C5,6, Duchenne palsy waiter's tip position. Resulting from excessive displacement of the head to the opposite side and depression of the shoulder on the same side, a blow or fall on shoulder. The position of the upper limb in this condition has been likened to that of a porter or waiter hinting for a tip or policeman's tip hand. The arm hangs by the side and is rotated medially. The forearm is extended and pronated. Duchenne's paralysis due to injury of upper trunk of brachial plexus. Brachial plexus injuries. Lower lesions of the brachial plexus, Klumpke palsy, lower trunk, C8, T1 lesion. Lower lesions of the brachial plexus are usually traction injuries caused by a person falling from a height clutching at an object to save himself. The first thoracic nerve is usually torn. The nerve fibers from this segment run in the ulnar and median nerves to supply all the small muscles of the hand. The hand has a clawed appearance due to ulnar nerve injury. Hand of benediction or Pop's blessings, ape hand, will result from median nerve injury. Thank you.